Hello friends, welcome to my channel Clinical Biochemistry with Dr. PK Prabhakar. Today I am going to talk about glycosylated hemoglobin. We are having two terms commonly we have heard about. It's a glycosylated or glycosylated, and it is also called as HbA1c test, which is commonly we are using test for diagnostic of diabetes. So I am Dr. Pranav Kumar Prabhakar, and today we will discuss about glycosylated hemoglobin and its importance, significance, and why we need to do it. So if we'll say what is glycosylated hemoglobin, this glycosylated hemoglobin commonly we are going to call hemoglobin A1c, or it is called as HbA1c. Which is commonly it is a common laboratory test which normally we measures the average blood sugar level for a 3 to 4 month, roughly we can call it 120 days. It normally gives us a valuable information for a long-term blood sugar level of a person. Long-term means roughly I have told you for 3 to 4 months. Why 3 to 4 months? That we will see later on. This hemoglobin, or the glycosylated hemoglobin, or HbA1c, is formed when hemoglobin, which is a common protein of RBC, which is heme plus globin, and this hemoglobin is responsible for the transportation of oxygen and carbon dioxide in our body. This hemoglobin chemically associates with the glucose, and that is known enzymatically. That term, then we are having glycosylated hemoglobin, and that is called as HbA1c. So if you'll see this figure, we are having RBC. RBC is having different forms of hemoglobin. We are having one of the form of hemoglobin is HbA1, and this HbA1 is going to combine with different hemoglobins, going to combine with glucose, but mainly we are having this HbA1. So when this is going to combine with glucose, we are having glycohemoglobin, and because we know the hemoglobin's RBC's lifespan is roughly 100 to 120 days. So that's why I have told you, as soon as RBC combines with this one, and RBC lifespan is 100 to 120 days. So that's why this glycosylated hemoglobin gives us the glucose concentration of a person in his body from in the last 2 to 3 to 4 months, means roughly 100 to 120 days. So this normally this HbA1c gives us the control in last 3 to 4 months. So if you see, this is on my left hand side, we are having a normal HbA1, which is having two alpha chain and two beta chains, and right side we are having HbA1c, which is having the two same structurally it is very similar to, almost same to the HbA1, but this HbA1 is going to have the association of glucose. Roughly 7 molecules of glucose is going to combine that one with the hemoglobin, especially beta chains, and then we are having glycosylated hemoglobin. How this is going to combine together? This is the, in the first picture, if you'll see, this is the hemoglobin where we are having NH2. That is the, this is the valine molecules, and bottom we are having glucose. So aldehyde group of glucose we are having. If you'll see here, so this is the glucose aldehyde, and this is the amino group of valine of hemoglobin. So this amino is group is going to combine with this aldehyde, and ultimately we are going to have a form of CIPS base. This CIPS base ultimately rearranges themselves through a Amadori product, and ultimately we are going to have the formation of this glycosylated hemoglobin. So glycosylated hemoglobin arises because if you have seen this one, so glucose arises from a non-enzymatic attachment of glucose to the hemoglobin, and they are formed and accumulate in the RBC production to the blood glucose level. Their concentration normally reflects the long-term, roughly 3 to 4 months average glucose level, and is very useful indicator for the, especially for the diabetic persons. The formation of HbA1c proceeds via the CIPS-base adduct. Adduct means addition product. When two chemical molecules join together, we are going to call adduct. And in this case, especially this is aldimine, which is after that one going to have a Amadori rearrangement, which we are going to see here, and ultimately we are going to have a Amadori product formations, and that is ketoamine, and that is our glycosylated hemoglobin. The aldehyde intermediate is often referred to as the labile HbA1c, and the rate of the conversion of, because this rate is uh, slow and this is fast. So now if we'll see how many different types of hemoglobin we are having. So the most common forms are HbA, HbA2, HbE, HbF, HbS, HbC, HbH, HbM. So different types, a number of types of hemoglobin we are having. In the healthy adults have a significant level of HbA and HbA2. So this is most commonly, and the maximum concentration of HbA and HbA2 A2 we are having for adult human being. Others concentration is very negligible. Some people may also have a small amount of HbF, that is called as fetal hemoglobin. This is the main type of hemoglobin which is in the fetus. So this is in the unborn baby's blood. Certain diseases have associated with the high amount of fetal hemoglobin HbF. When HbF is more than the 2% of the total hemoglobin, that is the disease conditions. HbS, that is the abnormal forms of hemoglobin which is associated with sickle cell anemia. In people with these conditions, the RBC sometimes have a crescent or sickle shape, and this cells easily breaks down and can blocks small blood vessels. So that is the drawback of that HbS. HbC, that is another abnormal form of hemoglobin associated with the hemolytic anemia. The symptoms are much milder than the sickle cell anemia. Other less common abnormal hemoglobin molecules cause other types of anemia. If you'll say this, here we are having normally hemoglobins have two alpha chain and two beta chain commonly. So in the case of embryonic, beta chain is the uh, epsilon forms, and alpha chain they are having eta and eta 2, and so HbA over. In the case of fetal, we are having two different forms. This is one form. This is two forms. In the case of fetal, this is the composition of chains, polypeptide chains. In case of adult, we are having beta and lambda. So we are having alpha to beta 2, that is the A1, and HbA2, that is alpha to delta 2. So in the adult, we are having two forms of delta chain, means beta chains. Either it will be beta form, it will be delta forms. This delta form, when it is going to, it is the alpha 2 or delta 2, that is called as HbA2. And when it is alpha 2 beta 2, that is HbA1. So in adults, these normal percentage of different hemoglobin molecules are like HbA 95 to 98%, HbA2 2 to 3%, normally HbE absent, HB fetal hemoglobin very less, roughly 0.8 to 2%, HbS normal healthy human being it is absent, HbC also absent. If you'll see in the infants and the children, these are the normal percentage of HbF molecules. So in the newborns, 50 to 80% HbF will be there. After 6 months, only 8% HbF will be there, and over the 6 months, it is very less, roughly 0.8 to 2% maximum. What is the advantages of this glycosylated hemoglobin? Why we are going to use this as a test for the diabetes? In this case, the first thing is the sample can be drawn at any time of day. So it does not require the morning sample only, or the afternoon sample, or the fasting sample we require. So you can take sample at any time. So this test is not affected by the short-term variations, like if person has taken the diet, food, or anything. If person has done exercise now, or few days back, or 2 days back, or just now, or they have taken any medicines, hypoglycemic medicines, or person is in stress, or patient's attitude, or cooperations. So these things normally does not affect the glycosylated hemoglobin, because glycosylated hemoglobin gives us the information about the 2 to 3 months back. Then it differentiates the short-term hyperglycemia, like non-diabetic patient, like recent stress or myocardial infarctions. Some other advantages in this case we are having is gives information on the glucose imbalance in the patient with mild diabetes mellitus. It is less intra individual variability there, so person to person's variability is very less. Not affected by short-term lifestyle changes. It can do POC testing machines also. It is commonly available almost everywhere. And when we are going to compare with other tests, it is also relatively inexpensive. Then it may rise within 1 week after the rise of the blood sugar glucose due to stopping the therapy, and it will not fall for 2 to 3 weeks, 4 weeks after the glucose increases. So, for recent changes in the glucose or any kind of variation in the glucose uptake or the food or medicines, it is not going to be changed. Then, what is the limitation of this HbA1c? The first thing is that there are certain drawbacks. This cannot be used to find a day-to-day glucose fluctuations to adjust the insulin doses, because it gives us roughly long-term chronic cases. It cannot find a day-to-day presence of hypo or hypoglycemia. HbA1c may be consistently higher or lower than the expected based solely on the person's average level of glycemia or glucose. As erythrocytes age is going to age will decrease, HbA1c will decrease, and if RBC lifespan will increase, its concentration will increase. So genetic variability like hemoglobinopathies or thalassemias, that is going to affect this the value of this one. In case of iron deficiency anemia or alcohol uptake or salicylic acid use, which normally elevates the bilirubin because RBC will be degraded, in that case, its concentration is going to be affected. So there are certain cases where this concentration of HbA1c is going to be affected. Now, how this glycosylation occurs? If you'll see, we are having this is the hemoglobin, which is having 2 alpha. We are having alpha, and 2 beta. We are having, in case of beta chains, we are having a valine amino acid. So valine is going to take this glucose. So glucose is going to be associated with the valine amino acid of the hemoglobin. So ultimately, we are having glycosylated hemoglobin, and this glycosylated hemoglobin roughly lies into our body for 120 days, as the RBC lifespan is 120 days. We are having different variations like HbA1a more than around 20%, HbA1b, HbA1c, that is the maximum more than 70%. So this two roughly 20 to 25%, and HbA1c 70%. So that's why commonly we are going to use HbA1c for this test. This is called glycosylations. When it is going to associated with that a specific place, that is with the valine. When glucose is going to be associated at any places, when glucose is going to be associated at any places, that is called glycation. And this is in our case, in case of this one, when it is going to be associated with the valine amino acid, that is called glycosylations. So this is how it is going to be associated. Hemoglobin A1 consists of the following: HbA1a, HbA1b, and HbA1c. So if you'll see here, HbA2a, 2b, or 2c, A1, 2a, 2b, means that is HbA1, A, B, C. Going to combine with glucose. So we are first, it is going to fall pre-glycated glycosylated hemoglobin. This is the condensation reactions, where six base will be formed. Then the slow reactions, we are going to have glycosylated hemoglobin. Ultimately, we are going to have forms, and there we are having all three is going to form. So maximum or 80% we are having glycosylated hemoglobin HbA1c, because it is maximum stable, more highest stability of this one it is having. And this is normally later on it is irreversible bond will be there, irreversible reaction will be there, so it is not going to be converted back to the normal glucose and other things. So it normally predicts the glucose level of 6 to 8 weeks, and because the lifespan of RBC is 6 to 8 weeks. So HbA1c combines more strongly with glucose. HbA1c is 70% glycosylated, while HbA1a, 1b are almost 20% glycosylated, which just now we have seen in the previous slide. How it is going to affect the RBC functions and their other activities. So if you say glycosylated hemoglobin causes the increase of highly reactive free radical inside the blood cells. Radicals alters normally blood cells membrane properties. This leads to blood cell aggregation and increased clumping of the blood cells, where blood will be clot formation will be there, increased blood viscosity, which results in the impaired blood flow. Glycated hemoglobin or causes the damage to the also through inflammation, which results into the atherosclerotic plaque or atheroma formation inside the blood capillaries. Free radical, whenever it will be builds up, it promotes the excitation of Fe2 plus Hb through Fe3 plus formations into abnormal free Hb. So Hb2 plus will be converted to Hb4 plus mediated by Hb3 plus. So that is called as feral Hb. Hb4 plus is very unstable and it reacts with the specific amino acid in hemoglobin to regain its Fe3 plus oxidation states and makes the amino acids unstable. Hb molecules clumps together via cross-linking reaction, and these Hb clumps, that is multimeric forms of Hb, promotes cell damage and the release of Fe4 plus into the matrix of innermost layer, that is called as subendothelials of atherosclerotic arteries and veins. The results of increased permeability of interior surface, that is endothelium of the blood vessels, and the production of pro-inflammatory monocytes adhesion proteins, which promotes more macrophage accumulation in blood vessels surface, ultimately leading to the harmful plaque formation into the blood vessels. And this overall degradation of blood cells into release also releases the heme from them. The released heme, which is the loose heme, can cause oxidation of endothelial and LDL proteins, which results into the plaque formations. Now, if you see the measuring of this HbA1c, there are a number of methods are there. So, normally HbA1c we can measure on three different ways by charge differences. You can measure there are certain methods by which which works on the charge differences. There are some processes, some methods which works on the structural differences, and there are chemical methods also. When we are going to use charge methods, and there are methods like ion exchange chromatography we can use, HPLC we can use, electrophoresis we can use, and isoelectric focusing we are using, which is based on the charge differences or which measures the charge differences. When we are talking about the structural differences, then we are having affinity chromatography and immunoassay, and chemical of method is the third options. So three methods: charge difference, structural difference, and the chemical methods. Most common method is HPLC. High performance liquid chromatography. The HbA1c results into calculated as a ratio of total hemoglobin by using a chromatogram. Then we are having immunoassay, enzymatic capillary or borate affinity chromatography. Point of care methods at the time in the doctor's office or in the technician's device, a simple device can be used, which based on the immunoassay or affinity chromatography. Ion exchange chromatography, if you'll see, they measures normally HbA1, that is the total glycosylated hemoglobin, HB1A, 1B, and 1C. So ion exchange chromatography does not give, it is not very specific for HbA1c only. It is measures HB1A, 1B, 1C. HPLC, it measures both HbA1c and HbA1 can be reported. When we are going to use electrophoresis, in that case, it measures HbA1c but very less specific. Isoelectric focusing or immunoelectrophoresis uses HbA1c adequately, and it resolves different hemoglobins separately. When we are talking about the immunoassay, that is very specific for HbA1c only. Affinity chromatography, which is based on the amino phenyl boric acid bound to the agarose or bead, that is called a glass fiber matrix, to react with cis diol group of glucose, which is bound to the hemoglobin and which measures HbA1. So the sample, when we are going to take the sample for HbA1c, so the blood sample can be taken, and that is EDTA blood sample will be used. Washed RBC or lysate is prepared, which is stable for 4 to 7 days at the 4 degrees C. A blood sample can be drawn at any time. No need of fasting or dietary needs or any precautions is required. The purpose of this test is used to monitor the diabetic controls. This test shows the patient's average glucose index over a long period of time, that is 2 to 3 months or 4 months. The index of diabetic control gives a direct relationship between the poor control and the development of the complications. It tracks glucose in the milder form of diabetes. It also helps in the determine which type of drugs may be needed. It predicts the development of progression of diabetic microvascular complications. It measures the value of a specific group of patient like diabetic children, diabetic patient whose renal threshold or glucose is abnormal, unstable diabetes type 1 which taking insulins, type 2 diabetic women who become pregnant, patient with changing dietary or other habits. It should be reported every 3 to 4 months. Sometimes doctor advice slightly less times also, like 2 to 3 months also. What is this HbA1c results means? Whenever this results is below 6%, it's considered as a normal. If it is between 6 to 6.4%, it is considered as a pre-diabetic, and more than 6.5% or the higher, it is going to be considered as a diabetic. So this is the, if you'll see, this is the bar. Normally we are having, this is the pre-diabetic 5.7 to 6.4, below 5.7 it is normal, and above 6.5 it is diabetic. So this can be equivalent measures and equivalent to the glucose which you are going to see here. So the different value of HbA1c and their equivalent blood glucose value in the milligram also, milligram per dl also, in millimole also. uh, if the consideration means, it is called as if 1% decrease in HbA1c is equal to 37% decrease in the risk of macrovascular complications, or 1% rise in HbA1c increases 35 mg per dl glucose. So this is the roughly 1% decrease, 37% decrease in cardiovascular risk, or 1% increase is equal to 35 mg per dl glucose value. Whenever this decreases, microvascular complications also decreases, so it is going to improve the complications also. And because in the case of diabetes, major issue is the complications only. How we can convert glucose, normal plasma glucose, into HbA1c or HbA1c to the glucose? So this is the formula where mean plasma glucose is equal to 35.5 multiplied by HbA1c minus 77.3, or average blood sugar in millimole. This is in the case of mg per dl. When it will be in millimole, then we can use this formula. So this is the both the formula. This is for mg per dl and this is for millimole. So this is the equivalent of HbA1c to the millimole, or similarly it can be converted into the milligram per dl also. The HbA, sometimes the HbA1c level is seen increased in the case of newly diagnosed diabetic patient, uncontrolled diabetic patients, non-diabetic hyperglycemia like Cushing syndrome, means some of the other associated diabetes like Cushing, acromegaly, corticosteroid therapy, phenylcytoma, acute stress, glaucoma, or patient where spleen is having some issue, splenectomy, or alcohol toxicity, iron deficiency anemia, lead toxicity, opiate toxicity. In all these cases, the HbA1c level increases. There are certain cases where HbA1 level also decreases, like hemolytic anemia, hemoglobinopathies after a blood transfusion, chronic blood loss, or vitamin C or E intake in excess, or in case of pregnancy. So this is overall all the things which we should understand about HbA1c. What is the role, what is the significance, and how it is going to be forms, and what is its significance, especially in terms of for the diabetes. So hope you have understood it. If you have any query, any comments, you can write in the comment box. If you are not subscribed my channel, you can subscribe it. If you like the video, press the like button. If you have any query, you can write in the comment box. Thank you very much. Have a nice day.